Good afternoon, everyone. I am Dr. Gaurav Agarwal. I am consultant neonatologist at Kailash Hospital, Greater Noida. So today's topic on Mad Talk is neonatal and newborn care, general and skin care. So today I am gonna talk about newborn care, what is required at the time of birth, which is known as essential newborn care, and then newborn care at NICU, neonatal intensive care unit, and also newborn care after discharge, like post discharge newborn care. So first and foremost, after the baby birth, that we know that we tell as a essential newborn care is very important. So after the birth, baby required some basic care. We call it as essential and routine newborn care. So as a part of that, baby's umbilical cord clamping should be delayed if the baby is doing well. Also, along with that, immediate drying with warm linens is important to maintain temperature of the newborn baby. After drying, assessment of the baby's breathing, and if baby is doing fine, then furthermore care with the mom. Like with the mother, we usually do like skin to skin contact, so the baby's temperature will be good, and mother and baby's attachment will started in labor room. And early initiation of breastfeeding is very important part of basic or essential newborn care. So these are the things that I have elaborated for basic or essential newborn care. So we usually do this type of care when the baby is born and baby is doing fine. So we'll do all the steps by maintaining temperature, cleaning the baby and keep the baby and mother together and initiate breastfeeding as soon as possible. Other aspects of newborn care, as I discussed, the other aspect is NICU care if the baby is in NICU. So, and along with that, newborn care is very important for baby's development. So in NICU, we usually do, and it is recommended to give a neuroprotective care. So what is that neuroprotective care? So neuroprotective care comprises of focusing on different aspects. I will discuss it later. So different aspects to provide good newborn care, because the baby's brain is growing and there is a neurological development. So the main focus is to provide a care that has less neurological and developmental issues. So it comprises of safeguarding the baby's sleep, providing essential nutrition, optimizing the nutrition, family centered care, involvement of the family in decision making. Also, like in some units in India as well as abroad, they are keeping mother and baby together, so they are not separating, so that family is totally involved in the care of newborn. Along with that, like umbilical cord care, as I mentioned, should be good. There should be less noise and less lights in the NICU. Also protecting the skin of the baby to reduce, because baby's skin is very sensitive. So protecting the baby's skin is also an essential part of neuroprotective, or we usually call like developmental centered newborn care in NICU. So that helps in improving the baby's outcome, like premature or preterm infants, their outcomes and the neurological injury is very less, and it improves their outcome. Also it helps in decreasing the hospital stay. So as I discussed, so multisensory stimulation means like stimulation, giving stimulation to the baby in different way, like visual, like auditory, and also like vestibular, and also like touch stimulation. So these stimulations help babies a lot, and that is a part of newborn care. So I will discuss in detail about multisensory stimulation in my later part. So as a part of NICU care, babies do sense smell, babies do feel the touch, babies do feel the vibration, and babies do feel the noise. So they also feel how the environment is going. So loud noises and loud light should be avoided, but also touching your baby, singing like singing new sounds with the baby helps their growth and development. So as a part of newborn care for premature infants, and as I mentioned for the term infant, skin to skin contact and is very important, that enables like bonding between mother and baby. And also skin to skin care helps for premature infants for maintaining temperature. So skin to skin contact should be start as soon as possible for term babies, and also if the babies are sick and as soon as they stabilize, skin to skin contact should be done. And also, as I discussed, multisensory stimulation is given by skin to skin, like if you are taking care of your baby and keeping skin to skin contact, so you will get to touch your baby, you will able to maintain a eye contact, if you will be able to like talk with your baby, giving some sound. So that helps in multisensory stimulation, and that is really the optimum part to provide a newborn care. So these are all the things that I mentioned in the hospital. But the major chunk of the care that when the baby is discharged is given by parents. So that is like post discharge newborn care. So what exactly is the post discharge newborn care? So post discharge newborn care, so primarily there are multiple points, so I am gonna discuss one by one all the points that post discharge newborn care that parents should look after. Like first is feeding. So the first question arises like how we feed the baby, how frequently we feed the baby. So baby, the term baby should be feed like around 2 hours to 3 hours, and primarily we say like at least whenever the baby demand, you should give the feed. And which milk? The breast milk or either express breast milk is best for the baby. And if the baby is premature, low birth weight, we usually say like feed every 2 hourly, so that baby will get enough calories, good volume, and also get good nutrition. So frequent nursing is advised, and also frequent nursing is helpful when the baby is having low birth weight. So frequent nursing gives more calories and protein, and that helps the growth of the baby. And but another thing that arises, can we give gripe water, can we give some other things to the baby? So nothing is recommended evidence like only milk, that is only breast milk. And if there is no breast milk or the mother is initial part, then some formula based milk can be given, but try always breast milk and breastfeeding, but nothing other than breast milk, like gripe water, honey, and artificial teats. So these will cause more problems and confusions in the baby. So don't introduce and don't give these things to the baby. So another aspect of baby's care is umbilical cord care. So babies, when the baby is born, the umbilical cord is attached to the mother's umbilical mother through the placenta. So when the baby is born, there is a stump we apply on the umbilical cord. So on umbilical cord there is a stump, and slowly it get dried up and fall off. In some babies like in a week, or in some babies it takes like around 10 days, sometime prolonged till 14 days, so that need not to be worried. But what is most important is that keep the cord area clean and dry. So previously or anciently, like some people used to put some powder, some oil, some water, but as of now nothing is recommended on umbilical cord. On umbilical cord, keep that area clean and also dry. So some parents ask me as well, like if we are bathing the baby, after that we can apply powder, but nothing is recommended. Keep that area dry and clean, because if we will put a lot of things, there are multiple chances of getting infection at the umbilical area, and that causes more trouble, and that will hurt the baby more. So nothing need to be applied. If there is any concern regarding the umbilical care, if something is oozing out, if it is not healed properly, then that is the better option to show your pediatrician or neonatologist as soon as possible. So the other thing that is very important, and that is the other part of my topic today, that is skin care. So there is a lot of myth, I will say, on the skin care for newborn babies. but always evidence based skincare is recommended for the care of newborn. So what is evidence based? As I discussed earlier, multisensorial stimulation. So multisensorial stimulation and providing skin care through that is recommended as an evidence. So what is that multisensorial stimulation? So in multisensorial stimulation, like I'll come to the parts what exactly it is. So if you are doing massage, so traditionally from many years massage is going on in our country, and it has been like going traditionally, but it has evidence based implications as well, and as of now it is recommended as well. So giving gentle massage, so giving gentle massage give the baby a multisensorial stimulation by touching the baby, by giving a physical contact, and also by eye to eye contact. So massage is recommended, and it helps in maintaining good sleep pattern, improving the sleep rhythm cycle. Also it increases the blood circulation through the gastrointestinal tract, cardiac and circulatory tract, and also it helps in the bonding between mother and baby. It gives more relaxation to the baby, and as of now, like it generates the heat, so that it helps in thermoregulation. So massage provides better sleep, better bone health, improve circulation and good sleep. So it's always recommended to do massage, but it's like not a professional, but like traditional how we do. But for 15 to 20 minutes, this massage is recommended. And along with that, how it goes, like which oil we use. Sometime like in since the ancient time, that is using we are using the vegetable oils, but as of now only coconut oil, sunflower or mineral oil is recommended, because mustard oil, baby's skin is very sensitive. With the mustard oil they have little bit, I will not go in detail, but they have chemicals, so it causes contact dermatitis. And even olive oil also causes erythema and destroy the skin barrier, because baby's skin is little bit acidic and very sensitive, so it disrupt the skin barrier. So preferred oil is coconut oil, and along with that either sunflower or mineral oil can be done, but no mustard oil and no olive oil is recommended. So basically these are the oils that provides emollients, coconut oil, and it's recommended as of now. So as I mentioned, that massage is recommended for 15 to 30 minutes, and preferably 1 to 2 hours post feed. So preferably that is a preferable timing. And after the massage, the other thing that comes regarding the bathe of the baby. So first and foremost question that arises, can we bath the baby on first day? Yes, you can, if the baby is fine, baby's weight is more than 2500 grams, 2.5 kg, baby has no concern, we can give baby's bath as early as within 6 hours as well. Keep that cord area dry and clean. Swaddle and immersion bath is recommended, but the other thing is that nothing need to be applied, because baby's skin is sensitive, and as I mentioned, the pH of the baby's skin is acidic, like less than 6. So any alkaline soap or cleanser will harm that skin barrier, so nothing need to be applied in newborn period. So better to give a swaddle and immersion bath for 5 to 10 minutes maximum, and dry it with the warm linen, and after that give mother to mother skin contact for stimulation, touch, temperature regulation, as I mentioned. So this kind of like process helps in maintaining baby's hygiene and also maintaining temperature of the baby, and that also give more relaxation to the baby. So as of now, that as I told, like multisensorial stimulation. So what is that multisensorial stimulation? So tactile stimulation, we are touching our baby, that giving the baby a tactile stimulation, that is giving a physical touch. We are talking to our baby we are giving new sounds to the baby, so that is giving a auditory or hearing sensory stimulus to the baby, that helps in that helps in later development of the baby and good sleep pattern as well. The third thing is vestibular. So as we vestibular sensation, like putting the baby in hammock and little bit rocking movement helps in babies developing good sleep. And also in some studies it has mentioned that it helps in reducing infant colic. And last is visual. So when we are giving the massage, we are giving the bath to the baby, we'll do a eye to eye contact, so that helps in developing visual stimulus to baby as well. So we are giving a multisensorial stimulation to the baby by giving a evidence based skin care. So other thing that arises, as I mentioned, that now we have discussed about massage, we have discussed about bath. So what is the use of cleanser and what is the use of any shampoo? So cleanser, as I mentioned, baby pH is acidic, so it's better not to put any cleanser, or if possible put a cleanser with acidic or neutral pH, so that it will not affect the baby's skin, and it should be fragrance free, it should be irritant free. So and also there should be no artificial colors or anything, so that is good for baby's skin. And coming to the shampoo and the scalp care, some babies develop little bit, we call it as cradle cap, that is crusting, some crust like on the baby's scalp. So shampoo will help in clearing that crust, and coconut oil and the mineral oil loosen up. So you can apply a little bit coconut oil and then apply a shampoo. But again, the shampoo should be like tear free, and also the pH is below the tears, and also it should not be any like chemicals or like colors and the fragrance. So it is good for babies for the newborn period. And after that, again the point arises for the baby's skin. So as a skin moisturizer, so also the moisturizer should be used that is balanced and also does not disrupt the baby's skin barrier. And emollient should be there in the baby's moisturizer. So, and if we are not putting any moisturizer, then coconut oil is the best. So these are the basic things, like how we massage the baby, how we give the temperature bath, and then gentle cleanser, and also the moisturizer. So along with that, the other part of the skin care, we discussed about scalp, we discussed about the body. The other part is diaper care. So diaper care is very very important, because the diaper contains the urine and feces that gives an alkaline pH and also causes the skin maceration. So frequent cleaning and frequent changing of diaper is recommended, and it's better to give a time, like we call as like a diaper free time, so that there will be a drying and aeration in the diaper area, so it avoids skin irritation. So give a diaper free time, and also clean the diaper area with a soaked cotton in the water from front to back. So I'm repeating, like we have to give we have to clean, like wipes are not recommended, so better to clean with a cotton soaking warm water from front to back. So that helps in not disrupting the skin barrier and also try to avoid diaper as much as possible. So it's better to put homemade cotton nappies and change it frequently, and also give a diaper free time, so that there will be better aeration and drying of the areas. And if there is any skin disruption, or it looks like diaper rash, so petroleum jelly or zinc oxide cream can be applied in the diaper area. And usually if you are putting diaper for the long, then normal coconut oil or mineral oils can be applied in the diaper area. So these are the things that has to be taken care when putting diaper and taking care of the baby during the diaper time. So the other aspect we discussed we discussed about the points of feeding, we discussed about the umbilical cord care, we discussed about the evidence based skin care at home. And now the other thing that we have to done at the home regarding like maintaining of the baby's temperature. So baby's temperature, the room temperature should be between 26 to 28 degrees centigrade, and the frequent question arises how we can layer the baby. So always layering the baby is recommended, like one layer to other layer, so that avoids the heat loss. But how much we can cover the baby? So I always say don't undercover or overcover the baby. Try to put one or two layers that you are feeling how you are feeling, not much of blankets or much of the thing. And the other aspect is safe sleep. So as a part of the newborn care is important, like what is safe sleep? So safe sleep means like lying on the back. So always try your baby to you always keep your baby to lie on the back, no side sleeping, no prone usually like sleeping on the face or sleeping on the tummy. That is not recommended, because there are a lot of evidence and that lot of the studies that mention that sometimes baby is having the concern like sudden infant death syndrome that happens because of sleeping on the tummy or sleeping on the face. So it's always a safe sleep to sleep on the back, lying straight, no side lying, nothing need to be applied near the baby like any soft toys or any pillows or something, nothing need to be applied. No pillow is recommended in newborn period and beyond till 1 to 2 years. So only the safe sleeping with lying on the back is recommended for baby. And the other part of the newborn care is immunization. So immunization, the birth immunization has been given in your hospital when the baby born at a hospital. So we usually give the birth vaccination for BCG, hepatitis B and oral polio. And later on, as per the immunization schedule, you have to get vaccinated, like first vaccination at 1.5 months, and later on you have to go from there. So other thing that follow-ups and danger signs. So follow-ups is like in the first month of the life that we call as a newborn period. So newborn period you need frequent follow-ups. Firstly, like after discharge, if you have some question, if the baby is low birth weight, then you need to visit frequently, or to check for baby jaundice as well, because some babies have jaundice in first 10 days of life. So you have to frequently visit, and thereafter only for monitoring of growth if recommended by your pediatrician in first month of life. And later on for the vaccination you are coming, and and then after that it is always recommended to check the growth on later immunization or hospital visits on 3rd month, 6 months, 9 months and 12 months, and later on to check the development or growth and how the baby is growing. And what are the danger signs? So newborn care, these are the care we are giving, and we have covered the aspects, what is essential in the hospital, what is essential in the delivery room, what is essential at the home. But the other thing is danger signs. So what are the danger signs? So coming to the danger signs, like whenever you are caring your baby at home, and if you feel that baby is not doing okay and baby is not looking normal, how the baby looks to you normally, like baby is not feeding well, baby is doing persistent vomiting, doing vomiting again and again, baby's tummy is not looking soft, it is more distended, and baby is breathing very fast and having some retractions in the baby's chest. So baby is developing any breathing difficulty, baby looks more bluish, we call it as cyanosis. So baby looks more bluish, or any uprolling of eyeballs and looking more unconscious type. So these are the danger sign you will look for, and if it is there, then it's better, and it is an emergency. You have to visit the nearby hospital as soon as possible for these danger signs. So these are the things that I have discussed about newborn care, and these are the basic things that we usually and routinely do for all the newborn babies in our hospital as well, and also suggest the parents to do at home and follow the babies for the growth monitoring, weight checks, jaundice monitoring on subsequent visits. So there is a question from I think Mrs. Sneha. So for preterm infants, as I mentioned, it is very recommended for taking care of feeding, for taking care of temperature. So for feeding, as I mentioned, frequent nursing is very important. and always monitor the growth. So firstly, like in 2 weeks, every baby's weight decreases and catch up till the birth weight. But later on, preterm baby's weight should be gained by like 20-25 grams per day. So according to that, we have to optimize the nutrition, and feeding the baby with a volume in every 2 hours is very important. And sometime when the baby is low birth weight, less than 2 kilogram, we usually add protein supplement like human milk based fortifier, so that baby will add more protein and calories. But along with that, temperature regulation, like keeping the baby's temperature on 26 to 28, multi-layered clothing, like layer to layer clothing, and whatever you are feeling, one layer more than that is important. So it is recommended for preterm infants, and for baby preterm infants and low birth weight infants, it is better to delay and postpone the bathing till the cord fall off. So if the cord is falling off 10 days, then till that you can sponge, and later on you can give baby a bath. Yeah. As a first time mother, what all should we know and take care of? So as I discussed, I tried to cover everything for new parents as well. Like whenever the baby is at in the after the birth, when the baby is in the hospital, so try to give baby skin to skin contact, establish bonding, give rooming in, and also do initiation of early breastfeeding. That is important. And later on, post discharge care, as I mentioned, try to feed and nurse your baby as ad lib, how much the baby demands, and maintain and regulate the temperature. Dry cord care, nothing need to be applied on the cord. And also evidence based skin care, like multisensory stimulation by giving gentle massage, and then giving bath to the baby for 5 to 10 minutes with lukewarm water, and then later on putting little bit moisturizer or coconut oil is fine. Providing good diaper care is also important. The other question is, what are the vaccine recommendation for newborn baby? So newborn baby vaccine is recommended. Birth vaccinations, birth vaccinations, birth vaccinations like OPV, like oral polio vaccine. So birth vaccination like oral polio vaccine and other thing like BCG and hepatitis B is recommended for newborn baby. How often should we bath the newborn? So as I mentioned, if the baby is doing good and more than 2500 grams, you can give the baby as soon as possible within 6 hours of the birth. And gently, like in winters, you can give frequent baths, but like alternate day bath is enough. Alternate day bath is enough for the baby in the initial newborn period, and later on in summers you can give frequent baths. I think these are the questions only, and I'm going to finish my talk here. I am thankful, and I give thanks to Kailash Hospital and also my viewers for attending today's live session. Thank you.